Hey, Dinks. Welcome to another exciting episode of Dentist in the Know. I don't have the script that Jeff reads because normally he reads from his own script. He did send it to me. I really should read it, but I don't have it handy. So we're just going to have to dive right into the show. Maybe I'll go back and reread it later for our lovely friends on the actual podcast and not for our YouTube audience. When you go live, YouTube people, you just kind of get what you get, right? Thanks for joining me tonight. I am all by myself. Jeff is on his way to AADSM. Can we talk about that for a second, actually? Because last weekend he was spending time at the Marby Symposium, which I heard was amazing. Some amazing clinicians were presenting there. The latest research and information on Marby and airway management for the dental population. And then this weekend, he's off for another deep dive with the AADSM. If you're not familiar with that, that is the American Academy of Dental Sleep Medicine. Hopefully I got that right. And one of the more top level organizations for dental sleep medicine. I would say probably the top dental sleep medicine organization out there, pushing a lot of research, really empowering dentists to be a part of sleep management in their practices and working with patients to get the care they need. Why is this so important? Well, I don't know, because maybe in just a few months, getting close to like 6 months, Dentist in the Know is going to be hosting their very first live in-person event. Now, this is the first time I've really been able to talk a lot about it, so indulge me for just a moment, if you will. We're hosting a live event November 5th through 7th in Murrells Inlet, South Carolina. Let's talk about Murrells Inlet for just a second. Beautiful area of South Carolina. If you've never experienced the East Coast Mid-Atlantic beaches, that is the absolute best place to be. And in November, you can still have really comfortable days in North and South Carolina. Murrells Inlet is this beautiful waterside town, great fresh seafood, great golf, great activities, really quaint and really beautiful little seaside village. But we're really fortunate because Jeff also has a teaching facility there. So we're going to be doing 2 days of full education. Thursday night, we're going to come into Murrells Inlet. We're going to have a live event that evening with one of our favorites. Dr. Doug Thompson is coming to Murrells Inlet to start the conversation about wellness, function, and how we holistically take care of patients. It's going to set the tone for the whole weekend of our functional symposium, where we're looking at sleep, joint management, function, how we set patients up for long-term health, and then how do we restore them into that? It's going to include Invisalign or aligner therapy. It's going to include restoratively driven orthodontics. It's going to include Marpies. It's going to include joint management. It's going to include sleep overview to kind of diagnostically look for those patients in your practice, to start screening for them, to help get patients the care they need. When you leave that symposium, I feel really confident that you're going to be prepared to see dentistry in a totally different way. Don't you think, Chad?
You know what? That's exactly what I think. How you doing, JB? What did I miss?
I miss you so much. I'm just telling the good people about our in-person event because Jeff is like out there doing the Lord's work right now, right? He went to the Marby Symposium last weekend, learning all about expansion. This weekend, he's at the Dental Sleep Medicine Group, learning all about the latest in sleep therapy. And every time he comes back, he gives me like top 10 things that are happening in dental sleep medicine that we need to be paying attention to. What's the latest research? What are people doing that's been effective therapy? What are the latest and greatest devices out there? Like, I love it. I get to kind of sponge off of him. We're not going to gatekeep anymore. We're going to take it to the functional symposium and give that information to everybody.
I will tell you that when you first pitched this to us, I was kind of like, I don't know about this. You know me. I've got reservations. I've got trepidation.
Yeah.
But the more that I've been reading on this, the more. I mean, first of all, folks, for those of you watching, listening, wherever you are, whenever you're watching this, Dr. Bell has just really put her heart and soul into this. And today I saw a packet that came out that we're sending to some potential partners. This is going to be awesome. It's done just so freaking next level. It's just going to be great. And
we're not going to do anything.
I know
simple.
we're not going to
I didn't even talk about
anything.
the fact that we're doing dinner waterfront on Thursday night at a really great restaurant. And then Friday night, we're going to do a band. We're going all out cocktail hour, close it out 8 to 11. That's like old people party style. And then, we do a half day education on Saturday to open up time on Saturday. Cause look, we know it's football season. We're not dumb.
No.
So we're going to wrap it up about noon, which for our early gamers, hopefully we can get you to a TV ASAP and some, tacos and maybe some beer. And then for our other later people, maybe you can drive to the game if you want to try to catch it, especially for our Clemson and South Carolina fans, our UNC fans here locally. So we're trying to get the right balance. For those of you who do not give a rip about football, there's golf and fishing.
Actually, I give a rip about football, but I carry YouTube TV on my phone. It will be plugged in on the golf cart, and there will be a tea time as soon as everything's over, and it will be Dinks hit the Myrtle Beach links. Dinks hit the links.
Why haven't we thought of that before?
Dinks on the links. Let's go.
Jeez, old Pete. That is the best slogan we've had all week. Okay. Well, I'm got to go work on some marketing endeavors.
Dinks again. On the links.
I want to tell you something. Do you ever have these days in clinic where today was actually a really good day? It wasn't like super profitable, but it was a good day where everything seemed to just kind of go the way you wanted it to go. And I had such a variety of procedures. I did composites, crowns, biopsy, extracted a wisdom tooth, 2 Invisalign consults, 2 Invisalign cases. Like, it was just this beautiful mix of
kind of like
what is so great about being a GP.
Beautiful mix of like what we call restorative dentistry.
Yeah, well, in the 16, I will say, taking out that number 16, I was like, why did I agree to do this when I told the patient I would? But in fairness, it actually came out really easy. So I didn't feel too bad about the decision, but normally if I see that, I send it out. So, but all I kept thinking was, how great is it to be a GP? Because I kind of got to pick and choose all the fun things that I wanted to do today, and anything I didn't want to or didn't enjoy, I got to send to somebody else.
That's the way that it goes sometimes, and I think that's kind of one of the true signs that you need when you're headed towards burnout, kind of doing the same thing. And
yes.
Then, it's ebb and flow in dentistry. Some weeks you get just the stuff that you just like, gosh, why is it?
Yeah.
Seems like it's an entire week of fillings. Actually, you know what? This morning, I hate to say this, and I know the patient's not watching, and of course I'd never say their name, but I had like 3 like MODBLFGYCK fillings, and they no-showed. And I was like, this is a blessing. Yes. I was like, they're like, hey, do you want us to call so-and-so? They've been trying to get in. I'm like, no, I'm good. I'm going to go sit in my office. I'm going to pay bills. I'm going to drink a cup of coffee. I'm going to do this. I'm going to do that. I get it. I mean, and then, dentistry, like I said, it's just so ebb and flow. Sometimes there's a bunch of mundane, same, but the variety is really what we strive for, and it's really awesome when we get it.
Yeah, to me, that's what's so great about being a GP. Yep. I'm sure being a specialist has its own charm and predictability, but I love the variety. I love that I had my laser out today. I mean, I was scanning CBCT, like the tech was humming.
What would you hate to do all day, every day? And I'm going to tell you right now. Okay. So the answer is not composites. You cannot answer composites.
No, because I married that word.
But
right?
What would you just like if you saw it on your schedule that it was just the same day of X? What would X be?
I think it'd be endo. I feel pretty confident about that. I didn't do endo for terribly long, probably 6 years. And at no point in that 6-year time period did I enjoy it.
Yeah, I haven't done endo in a long time.
I just found it so
It's
unpredictable. You could
unpredictable,
go into a tooth and it would be easy.
and I'm too hard on myself.
Yeah, for
It was
sure.
just like I never felt that anything was just looked great. There were very few times where I was like, "Oh, hot damn, that's awesome." Mine would be scaling and
Yeah.
root planing.
Oh, you don't like
Hell
that?
no. Mm-mm.
Oh, it's so
But
satisfying. It's like a Dr. Pimple
okay,
popper.
but let's talk scaling and replaning where you see no calculus on the radiographs.
Oh, then what are
Yeah,
you
but you know
doing?
what? The worst part about scaling and replaning, I don't mind it. It's the freaking and anesthetizing the patient. I
Yeah.
can't stand it.
Can your hygienist anesthetize in your state?
No, but we're using a really good topical that the patients seem to
Yeah.
appreciate and like. But you know, I just like I dread going into the hygiene room when I have to anesthetize the patient. Our hygienists love scaling replaning. Thank you. God bless
Yeah.
you. But like anesthetizing the patient, I just feel like you're treating them like a damn pincushion. You know?
Right. I when North Carolina and oddly enough, I can't believe North Carolina allows it and Texas doesn't because we have like the most conservative dental rules. Because you guys can do unsupervised care, we can't even do unsupervised hygiene. Uh, but they did allow them to get their anesthesia license, so they can do blocks and they can do infiltration. Most of them don't block; they'll just
Yeah.
infiltrate around the tissue and stuff. But that has been huge. Like not having to go in for SRP. I don't see it on the schedule anymore and go like, how the hell am I going to figure out how to get over there and get back over here?
Yeah, I get it.
And it's hard to inject comfortably because you're in a
I get
rush.
it. But hey, I will say this, and I am, and you've heard me speak. You know probably what I'm going to say. Good topical is a must.
A
A
must.
must. And do not let them
Yeah.
some bitches swallow it because if they do, you're going to get some wet lung syndrome. But that good
No,
topical
I know.
is stuff. Hey, speaking of which, speaking of good
What?
topical, when we were at Midwinter this year, right behind us was the booth for the, I think it's called Maxi Mist, the nasal anesthesia.
Oh, okay. All
So
right.
my business partner, love him dearly, but he is a huge gimmicky guy. He's like, he sees it, he buys it. So we bought it. We're so excited to use it. Not one patient has agreed to it yet. Like, I don't want you picking that up.
Have you numbed
Do
yourself?
what?
You should
We're
just numb
going to
yourself.
because I'm like, I got to be able to pass on experience. Now, the biggest thing is tetracaine, bupivacaine, and phenylephrine.
Is this a Malamed product?
I don't know if,
He kind of was on that bandwagon for a long time of creating the
but
inhalant.
it'll block
Or,
it. It's the ipsilateral side, so it'll block 5 through 8 and 9 through 12. So I'm super excited to try it, but you know, like I always give patients because you know, you walk in there trying to stick something up a patient's nose, they're probably not too cool about it.
they're like, wow, am I at the right place? I thought this was
Everybody
a dentist.
hates anterior injections, but they do not want to stick something up their nose.
That's so weird. I wonder if it
I
burns. I
I
need
have
to.
no freaking
Can you
clue.
do it on air next week? Can we do it live next week?
Okay. All right, I will do it live next week. It takes 15.
Okay. We can do it at the end if you
No,
don't
I'll do it.
want
It's a
to be
15-minute
numb for the whole show.
onset.
But
And from what I've heard from our colleagues, since it's got there's a little bupivacaine in there, since it's long lasting and it's not palatal. But yeah, I'll do it. I'll bring it home next week.
let's
All
do
right.
it.
Remind me. Shoot me a text. Remind me. All right, you
Okay.
got some news.
I mean, if you want to send all of us, we'll all get
Yeah.
numb.
All right. I mean, hell, we aren't using it at the office. I might as well send
You're
each
using
one.
it.
All right. So
All right. You mind if I do some news?
I think that's a good idea.
And then we have a great guest. I'm so excited. Last time I saw Rick was at the Align faculty meeting a few years ago. So I'm really excited to catch back up with him. He's got a really interesting story. And man, he's crushing it down there in Florida. So I'm just excited.
I haven't seen Rick in a long time. I don't even know if Rick remembers me. So
he does actually, which I thought he might not, honestly.
thanks.
Because
thanks. Yeah, I'm unforgettable.
a lot of people deny it,
All right.
but he does remember you.
All right.
So.
Take me away, Austin.
All right. Let's do it. Okay, a couple of news stories came across my desk this week that I thought was at least worth talking about, and I'm going to start with the one that surprised me the most, because I have seen a lot of articles and stories over the last couple of years about the dip or drop in opioid prescription writing for dentists. And maybe if we're lucky, Tom Viola might respond to this story to give us a little feedback. And if you'll recall, when the opioid crisis started a couple decades ago now, over, um, they cited dentists as one of the main problems. Dentists were writing an inordinate number of opioid prescriptions in the US, and that we were likely a big part of the cause. And if you're a dentist in the US now, you probably have a laundry list of requirements that you have to fulfill on an annual basis in order to continue to be able to write any amount of opioid prescriptions for the year. We take additional CE classes specifically just for opioid writing. Well, there was an article that came out, a study that was released on JAMA Network Open, which I'm not 100% sure how that's different from JAMA itself. The research was conducted. It looked at dental opioid prescriptions across the US, Puerto Rico, Canada, France, Australia, Germany, and the Netherlands. Now, first off, the US is still the number one prescriber of opioids. I think Canada was kind of a close second. Um, in a positive light, from 2021 to 2024, the US fell 27% in its opioid prescription writing, 10% in Puerto Rico. Larger declines did occur in Canada, France, Australia, and Germany. While that's all really positive, the US still was holding that top spot for the most. For instance, they noted that in the Netherlands in 2024, just 83 prescriptions were written per 100,000 residents. And in the US, it's roughly 24 times higher at about 2,000 prescriptions per 100,000. Now, here's where I got a little bummed. It stated that the US dentists are still the highest prescribers in the US. I really thought we had gone down. And we had. He noted, the author of the article noted that we have dropped 45% in our prescription writing from 2016 to 2022. That's a pretty big movement. I mean, I know personally, I might write one a year for a very unique situation, but I wasn't prolifically writing them before. I didn't think quite as much about it. But now you have to have a pretty good case for me to write a prescription for an opioid. But even at that reduced rate, we're writing it 4 times more than the UK and other countries. And we're still the number one provider, I think, of opioid prescriptions in the US. So they're still noting that we're overprescribing. We'll see where this story goes. We'll see where they take this particular data. Probably means more requirements will come our way in order to continue to get the number down. But while we're making the right progress, at least we're still seeing that there's a significant number of opioid prescriptions still coming out of the dental community. An interesting story. We kind of talked about the story actually a while back. It was last year. There was an imposter dentist who then hired a hitman to go kill a patient who complained about their work. Well, they have been arrested and now face trial for up to 25 years in prison for this hitman. This dentist was alleging they were a dentist. They weren't really a dentist. They were performing a dental procedure. The guy, there was a mom who was getting the service. The son was filming the service, which had evidence that an unlicensed dentist was providing dentistry. When things didn't go well and he wanted his money back, the dentist denied reimbursement. Or I should say the non-dentist dentist denied reimbursement. The son of the mother said she had it on film, so he was gonna take it to authorities. So then the non-dentist dentist decided to solve this problem by hiring a hitman. I mean, the number of wrongs in the story, it's like they were wrong, they were wrong, they were like everybody's wrong in this story. Unfortunately, one person is dead and a couple people are going to go to jail. And that poor lady still had really terrible dentistry done. And I don't think she ever got that fixed. So really no winners in that particular story. A last news item for this evening. And this is near and dear to our hearts because we had an Olympian on our show just a couple of weeks ago. If you didn't check that out, we had Dr. Tara Peterson from our U.S. curling team came on the pod. Great, great episode. We had a blast with her. So if you feel a compassion towards our Olympic and Paralympic athletes, the ADA is working with the U.S. Olympic and Paralympic Committee looking for volunteer dentists to provide free basic dental care to eligible athletes. If you live in the following areas: Colorado Springs, Lake Placid, and upstate New York, Charlotte, North Carolina, Salt Lake City, Park City, and Provo, Utah, Miami and other Florida locations, Atlanta, San Diego, Los Angeles, Dallas, Austin, and Houston, Texas, they are looking for you. They're looking for oral and maxillofacial surgeons, orthodontists, and endodontists, as well as general dentists. Experience in sports medicine would be helpful, but not a requirement. Now, a lot of times these athletes are spending a lot of their resources paying for training, their coaches, etc., to be able to continue their journey and need additional help with their care. Tara also mentioned that when athletes were traveling, especially from non-US countries, they would specifically wait to get dental care provided to them in the Olympic Village because there was a dentist on site there that could provide them services while they were in the Olympic Village. So this is just part of the journey for supporting our U.S. Olympic team. If you're interested, go to the ADA website. Under ADA News, they have more information if you search Olympic and Paralympic and join their volunteer network. I got to tell you, it sounds kind of interesting to me. And with that, that's the news. They said Dallas.
You did. That's a. I would go if I got to go. I would do it if I got to go overseas.
Oh yeah, they're not looking for Olympic Village volunteers yet.
Yeah, then I have no interest. No, I'm teasing. I would be happy to. That's something that's great that we could all do.
You ready to bring our guest?
Yes, but I want to throw something out there for the news, and I think that this is maybe controversial, but I would like to maybe for us to put together a little bit of a recap of what happened this past week with the past ADA president, the issues and everything that happened. Trust me, I'm not taking sides because I am not well versed in it, but I would love to kind of, there's been a lot of chatter as to what went down, and I'd love to be able to bring some light to that. Thoughts on that? Are you cool with that?
Yeah.
Okay, cool. Let's bring our guest on.
All right. I am so excited to introduce my friend. I think I can say my friend, Dr. Rick Mars. He practices in Miami, Florida. He's got multiple practices. He's written a book. I mean, I don't know when you have time to do these things, but that's fine. He has so much to share about his journey. He's also an Invisalign provider. He's been using the new Lumina Scanner, so I definitely want to hear about his journey with that. I'm just so excited to have him on the pod with us tonight and to talk, geek out about all things dental, because that's what we do here.
Okay, well, I don't want to start on a negative note, but my office manager, when she told me about this podcast, I thought I was going to be on SmartList, and I'm a little I got Chad Duplantis. Jennifer, you're great.
Oh, shut up, Rick.
You didn't think I remembered you? Seriously?
Dude, I mean, you're like a legend. I was like, I'm a small guy, dude. You're a big guy.
Oh, no. I'm a legend in my own mind.
Yeah. We had some great conversations in Costa Rica, man.
Yes, now, absolutely.
Wait, you guys have been to Costa Rica?
Well, let's rephrase that. We went to the Align facility in Costa Rica. It's not near a beach. We did have sloths on facility. We had a great time. Horowitz was there. It was good stuff. We had a good time.
Didn't you also do a day in the life with Invisalign?
Oh, yeah, we did that too with Mark Nelson many years ago. Yeah, that's right. Yeah.
And Jennifer did one of those. We had a lot of celebrities. You guys.
A lot of celebrities.
You got your start there, so.
I did. I cut my teeth.
I guess, Rick, that goes back to like 2017. I mean, I know I had heard of you before then, but we first met in was that 2017 when we were in Costa Rica?
You asked me dates. I'm the worst guy to ask dates to because I cut out COVID years.
I was just going to say, was it pre or
Oh
post
yeah,
COVID?
it's
It was
either
pre
before
COVID.
COVID or
It
after
was
COVID.
pre-COVID, but when you're counting years, you cut out COVID. So you might say it was 5 years ago, but it was actually 8 years ago because you cut out the COVID years.
I don't mean any disrespect as a Christian, but now it's like ACBC, like BC or after death and BC before COVID. I mean, it really is kind of that mentality. And I always compartmentalize time and, oh, but that was before COVID. So it could have been anywhere from 2020 to 1978. I don't really know where it was in that time frame.
Exactly right. Exactly right. But by the way, that was a great story about the fake dentist and everything he's doing. And can you imagine? We're so worried about like nicking the adjacent tooth on an MOD or a crown prep or something. And this guy is sitting there practicing without a license.
Yeah.
And
the guy, I mean, the whole story is so filled with crap. Like this guy took his mom to an unlicensed dentist, must have known enough because he filmed the whole procedure.
Well, there's clues when you do that. I mean, we have a lot of that happen in Miami. And, when your dentistry is being done in the back of a station wagon or a van,
correct,
clear sign that may not be a licensed dentist, in a factory or in a warehouse, things like that.
A Holiday Inn.
Or somebody's house.
Yeah.
Back room in their house. So,
do you have like a top 5, this dentist may not have a license list? Like practices in a Holiday Inn.
Wraps their car with, there's one in Irving, Texas. They wrap their car with like something about veneers, but not an official dentist. That's going on. Yep.
I mean, I honestly have had a couple patients say to me that they knew they were going and they went there because of cost. And it was, you don't find too many winners in those cases.
No.
At the end of the day, people are very disappointed, and obviously, and there's a lot of people who practice dentistry in other countries. So by the time they do work on a patient here, I don't even know where they get dental supplies from and all those things, but
you can buy it on eBay.
I got to tell y'all, since we're on the topic, I got to tell y'all a funny story, but I also have a lead into our first question. Okay. So real quick, I'll make this real quick.
We'll see.
So locally we have this page and everybody goes on like, who's the best dentist in the area? And it's a page that I never want my name to show up on. Right. So somebody posts, who's the best dentist? I need this, this, and this. And, the word cheap is in there, and in network is in there. And there were a couple other triggers. And I'm like, dear God, please don't anybody mention my name, because I just don't want to be seen in there. Not that I don't want to see my neighbors, but I want neighbors who want to come to me because I'm a good dentist, not because I'm the best price, not because I'm going to give them a deal. I want them to come to me because I'm a good dentist. Right. So anyways, this guy posts, hey, I just went to Mexico. I got the greatest stuff done. It was a vacation. It was this, it was that. And I got 6 crowns and 4 fillings for $1,900. And I got to lay on the beach and drink margaritas. And I was like sitting there thinking, oh yeah. Okay. So I look him up. Locally, he runs a limousine company, right? So I'm like, I'm not going to go bash your business, but I really want to, next time somebody asks for a ride, I want to say, call down to Mexico, right? But anyhow, so fast forward, his name was very, very unique. I won't mention it for privacy purposes, but it was very, very unique. So his wife she had the same last name, so I'm assuming it's his wife. She posts that she needed to get her cat neutered. And she was like, these vets are charging $760, $800. So I decided to comment anonymously. So I was Anonymous Frog 429. Yes, that's my name.
You're not anonymous
and
anymore.
I said, well, seeing as your husband goes to Mexico for his dental work, why don't you take your cat to Mexico to get neutered? It got a lot of likes and a lot of laughs, and I felt really, really freaking good about myself.
Did you feel vindicated?
Now, if they're watching this, I'm sorry. Yes, it was me. But we got to understand, we're educated. We try our damnedest to be the best that we can. And it's kind of a slap in the face when somebody goes to somebody that's unlicensed or somebody that does things because they're cheaper, whether it's in the U.S. or outside of the U.S. Go where you feel comfortable. And that's my lead-in question for tonight. My lead-in question, because we started talking about this, And I know Invisalign and Align is a big partner of this. Why do we believe in Align as a clear aligner company versus there are other good clear aligner companies out there, but why are they the best? And why should we go with Align versus Joe's clear aligners that does the same thing? You know, send your scans in, we'll figure it out.
Okay, so I'm going to answer two ways. So first, I'm going to answer from 25,000 feet, and then I'm going to bring it down to ground level. So if you say to a patient, you have a choice. You want it fast, cheap, or great quality, pick one. What are they going to say? Who in their right mind is going to say fast over great quality or cheap over great quality? They may try working it in there and saying, you know what? I want great quality, but at a fair price. No, pick one. What's most important? And, you know, dentists have a reputation for being, I'll be nice, I'll be politically correct, maybe as we go on here. I may not be as politically correct.
You don't have to be.
Okay. We have a reputation for being cheap.
Yeah.
That's what it is. And people look to cut corners in the wrong place. So if you have a choice of Joe Aligner Company, which is cheaper, or Align and Invisalign, which has like 25 million completed cases out there. 25 million. The track record. They've spent over $1 billion in research and development. And the only thing Joe can tell you is, I'm cheaper than Invisalign. Mm-hmm. Now, dumb dentists out there, and I say this respectfully to all the dumb dentists out there, charge a little more and do it right. Because where you think you're going to save money is not where you're going to save money. You're going to save money by paying a lower lab bill. Great. Your cases will never finish. You know, a lot of us are very particular how we finish our cases, but you know what? It's really nice to finish a case in one set of aligners. Mm-hmm. If you get all the goals accomplished in one set of aligners. So when you're doing Joe or some other brand, and we don't have to mention the other brand, because they're cheaper, it's not cheaper. What is your time worth? My time is so valuable to me. Yeah. So valuable that I come home to my wife, that I come home to my family, that I don't want to sit here and redo cases over and over and over and over. So it's thoughtless to me. Why? And what would you want? You know, I say that to patients. What do you want? And say that to dentists. Do you want Invisalign, the best aligner company in the whole world? Or do you want the cheaper aligner company because it's cheaper? Take your pick. And guess what? My aligner price, and I don't know where you guys and what your status with Invisalign is, but I am proud to say I'm a diamond provider. My aligner price is right where the cheap aligner prices is because of the discounts available to you when you do more and more cases. And it takes time. I mean, I've been doing Invisalign for over 20 years. So I've built up to a level where it's a huge part of my practice. It's over half my personal practice. But I'm only going to give my patients the best. Do you want the best heart valve? Or do you want the cheapest heart valve? If you're having cosmetic surgery, ladies, do you want the best breast implant? Or do you want the cheapest breast implant? Do you want the cheapest hip replacement, knee replacement, or do you want the best one? It's thoughtless. Why would you treat your mouth any differently than any other part of your body? But there is this thing with the mouth, and we all know it. We deal with it every single day, where it's a commodity. Patients don't often coming in asking for the best, but we have to redirect them. And honestly, I have never had a patient once come in and say to me, hey, do you mind, could you do clear correct on me or angel aligners? I have never had a patient do that because the conversation would end very quickly. As far as I'm concerned, I'm going to give you the best. And I'm not going to tell you they're not the best, but you want a company that has this decades-long track record. You know, it's really funny. I had the honor of speaking at the general session, the North American faculty meeting a few years ago, and I had to follow Joe Hogan. Can you imagine? That's like a comedian following Jerry Seinfeld. Okay, so I'm following Joe Hogan, and they were very careful. I said, can I mention how much Align spends in research and development? And they gave me this broad range, and the range was like approximately 400,000 to 500,000. And Joe came on right before me, and in coming on right before me, Joe literally says, we spent over $1 billion in research and development. And I'm like, okay, guess what? My lecture just changed. Did you hear Joe just said $1 billion? So that's what you're paying for. And you're paying for the technology. Align claims to be a technology company. It's in the name, Align Technology. So I'm giving you a long-winded answer, but it's like anything else. This is your body. You have one set of teeth. Do you want the best? Do you want the cheapest? Do you want the fastest? Take a pick. Pick one. We're all going to pick the best. And it's our job as clinicians to guide our patients. If we guide our patients on the right path, it's one answer. There's no
Well, I
explanation.
think you bring up when you say dentists are cheap, and they are. And the problem often is that they are the old adage, tripping over dollars to pick up nickels. They're focused on the wrong areas to save money. Like it's often a systems problem, a procedures problem, a training problem, where you're bleeding money at these different ports throughout your operations on a given day. It's rarely the lab bill. I mean, especially when you know what it is, it's rarely the lab bill that's the problem. But for a lot of doctors, it's just the one thing they can control. They can't seem to get systems in place. They can't take the time to do the training. They can't take the time to focus on that. But wouldn't you agree, Rick? That's really where the profitability engine starts to churn, that you can actually squeeze out profit in a well-oiled machine at that point. And I would argue that Invisalign is that type of system in your practice that is so predictable that you can build a protocol around it. Your team can execute it well, and it is a great profit center for you as a clinician.
I've been giving a lecture for years that Invisalign is the most profitable procedure in my practice. And people come back and go, oh, no implants. And I'm like, no, I don't think, not for me. Because when you learn to get very good at it, and I have a couple doctors in my practice that do it, but I do the lion's share in my practice, you just learn that this is an extremely profitable procedure, but it's a great procedure.
Yeah.
You're aligning teeth. You're keeping teeth healthy. I look at people. I have people that walk in their 70s, and I did their Invisalign 20 years ago, and their mouths look like they're 30 years old.
Yep.
You know, the teeth are aligned. They're healthy. They're not cracked. And the patients are like, they come in and they just need a prophy. They're not getting 4 quadrants of scaling and root planing. They're not breaking teeth left and right. And I've done an amazing thing. This is the one part of your body that you can make a decision to give yourself health.
Yeah.
We can't prevent cancer. We can't prevent diabetes. We can't prevent knee and joint problems that are happening. We can't prevent back problems. But you can decide, I'm going to keep my mouth healthy. And whatever age you start at, you're going to keep your mouth healthy if you make that choice and if you make that investment. But you're 100% right. They're short-sighted. They're looking at, okay, I can do X aligner company brand and do a cheaper aligner, and I can save $300, $400, $500 on my lab bill. But then they're in the second and they're in the third aligner set, and the case is going on and on and on. The patients aren't happy.
Right. Yep.
They're not referring patients to them. I mean, I think you guys would agree. You took out a wisdom tooth today, Jennifer.
God bless her.
How many patients is that patient going to refer back to you?
None. Zero.
You did a beautiful job on my wife.
Making a hole in my head.
Okay.
Yeah.
You did a great job. Invisalign gives me more referrals than any procedure, hands down, in my office than any other procedure. I'll do husbands and I'll do wives. I'll do mothers and I'll do sons.
Yeah.
And it's amazing. But you're not going to get those referrals when you're doing 3-4 sets of aligners and your lab bill is quote unquote free. But at the end of the day, it's not free. It's putting on new attachments. It's chair time. It's frustration. I mean, I love Invisalign. Invisalign has invigorated me as a clinician. It's got me excited because I'm doing dentistry like I never dreamed of doing when I was in dental school.
Yep.
And the tools, the technology are off the charts.
We had a patient call this past week, and it was a referral from maybe not one of our greatest patients, but they called the office and the question was, hey, there are Invisalign knockoff brands out there. I want to get my teeth straightened. Can you all do it with one of the knockoff brands? And, you know, the greatest part was our team came back to me and presented the question, and I about lost it. I was like, before I listened to the answer. And she said, no, our doctors have chosen the products that they provide within our practice based upon the quality that we convey to our patients. And I was like, that's a freaking awesome answer. That is an awesome
Good
answer.
job,
And I was
team.
like, and she was like, they're not going to sacrifice quality to satisfy your demands. And, if you want something else, then I would, suggest that you call somewhere else. But these are the products that we offer within our office. And Invisalign happens to be one of them. And it's because they believe in it. I was like, love it. You did the best you could possibly do, because that's what it's all about. I mean, I'm the type of person, I always refer to Invisalign as Kleenex, but the only facial tissue that we buy in the house is Kleenex. Okay. It's the freaking best. All right. And it's got to have the lotion in it, because if not, you're going to get the little fuzzies on your beard, and it pisses me off. And that's why we have to go with Kleenex in the house, because it's the best. It's been around the longest. It's the best. So,
Chad, I knew there was a reason I loved you, because I've used that same exact sentence at faculty meetings before. I mean, people don't walk in and say, can I have a clear aligner consultation? Or I'm interested in clear aligners. They come in and say, I'm interested in an Invisalign.
I walk out of Pepsi restaurants, damn it. Okay. I'm just going to say it right now.
Amen. Amen to that. You lost me at the lotion soaked tissue, if I'm going to be really honest with you on that
letting that go because I wasn't sure where your audience
Yeah, I didn't know where that one was going.
It's got to have the lotion in it, I'm telling you.
My wife does not buy the lotion soak one either. I don't know.
Damn it, Rick's wife.
So many really
Jennifer doesn't either. So
two out of three, you're looking. You're on an island.
Kleenex, sponsor our show.
We have to get off the tissue fast. Yeah. I'm spiraling.
Okay, fine. Charmin. That's all I use.
Okay, fine.
Won't buy Kirkland. Sorry. Love Costco, but won't buy Kirkland brand toilet tissue either.
That's fair. That's fair. Oh, I am going to tell a story just because it's funny. And probably my parents will watch this and be really mad at me, but that's okay. So
this podcast would be so much more unique if you guys name names. Could you imagine if you name that patient's name? I mean, you might get you might get sued and everything, but wow, that would really put you on the map. This podcast.
Sure would.
We're just going to call her Charmin.
Just make a note. Make a note. Or Kleenex with lotion.
Kleenex called. She wanted us to use Charmin. We're like, no.
Okay, moving on. So, Rick, you wrote a book, which is unique. A lot of us don't take the time to write a book. Tell us, but I will say we've had quite a few on the pod of doctors and other folks in the dental industry that felt inspired enough that they want to put pen to paper and kind of put a message out there. Tell me a little bit about, number one, how you got to a point where you're like, yeah, I definitely want to do this. Because it sounds like it was a real profit center for you. So I'm glad that you took the leap. And then what's it about? What wisdom were you hoping to impart?
Okay, so it's very funny you mentioned that, Jennifer, because I just have a copy of The Big Smile here right now, even though it's
when did it come out?
So talk about COVID. The book was released in January of whatever year COVID started.
Okay,
2021 would be the January because March was
we're shut down.
Yeah.
So I was supposed to go on a book tour and lecture all about The Big Smile, and it became a radio tour. And I was on some pretty cool radio shows. I was on these national radio shows.
Yeah.
I go on the national radio shows as a dentist. So what do you think everybody wanted to talk about in January of 2021?
Oh, COVID.
And going to the dentist, and is it safe? And it was not the most interesting book tour of all time, but it was pretty cool doing, I mean, some big names in the radio business, but
let's go ahead. Are you going to name a few or not?
We're not going to name the names.
Oh, listen to this shit. Yeah.
It wasn't Jim Rome and it wasn't Smartless. Okay. I'll put it right
fair. There. Okay.
So the book, I wrote the book I started writing the book and it went through 3 drafts. And the first draft I went through, it was kind of like I gave it to my sister, who was my first proofreader, and she came back to me and she said, you know something? This book is not you. It's not your personality. It's too stale. It's not funny. As you could tell, I like to have a good time in everything I do. It's not your personality. So I rewrote the book. So that was the second go round. And I added my personality to it. I said, screw it. I'm going to not name names. Everybody in the book is somebody I know's name for a patient or whoever it is. You know, the patient may be named Blake or Corey or Zach or Allison, my family, or, you know, other people in my family that I name to honor them, but no patients. And I had a lot of fun. And then I said, you know something? Who am I writing this book for? So I literally wrote the book for dentists and patients. Okay. It's called The Big Smile, The Principles of Modern Dentistry for Dentists and Patients. And one of the biggest themes of the book is there's such a disconnect between patients and us. So quick survey right now. Okay. Don't even think twice. When I said, Chad and Jennifer, what's the number one most important thing to you when you walk in that office and you're doing dentistry on the patient? What's the most important thing that you think about when you're doing a procedure? Chad, go ahead.
I'm going to say, I'm a weird person, but I'm going to say patient satisfaction, patient experience.
Okay. Jennifer?
Clinical outcome.
Okay. I will tell you, because I've done this survey, probably 95% of dentists say clinical outcome. Okay. You want to do good dentistry. Now you survey the patients. What's the most important thing to you?
Painless.
Dentists running on time. Price. Were they nice? Their chairside manner. These are the things patients are talking about. So there's a complete disconnect between what dentists think and what patients think. So now you think about it. So you're going to go to work and you're doing restorative dentistry and Invisalign and all these things, because every patient nobody wears a watch anymore, but everybody's carrying around their clock and looking at their clock. And that's how they measure how good their dentist is. He's great. He takes me in on time. She never runs late. Okay. He keeps me waiting 45 minutes every single time. He doesn't respect me.
Yeah.
So that's where I wrote the book. Okay. And the book was intended to bridge the gap and to say to dentists, guys, keep doing great dentistry, but you better think about what they're thinking about if you want to be successful in life. And for the first 20 years that I practiced, whenever I ran late, I would say to a patient, I am so sorry, but I had an emergency today, or I couldn't get a patient numb, or my patient before you was running 20 minutes late. And I'd give them all these excuses. And then I learned that's the dumbest thing to do. They don't care. They just don't care. But what can I do? I can apologize.
Yeah. I
am really sorry. I know your time is valuable. I'll do my best to get you in on time. Lots of times I had a patient last week. I saw her again. We delivered her Invisalign. She had a 4:00 appointment and we were running about 20 minutes late. And she was like a bull in a china shop. And she ended up saying to us, I wanted my fillings. I wanted my Invisalign. And I said, I'm going to deliver your Invisalign today. And you're going to see that's enough of an appointment, putting on your attachments, instructing you, going through everything you need to do, that you're not going to really want your fillings when it's all done. And I'm sorry I ran late, but you're going to see that. And at the end of the appointment, she apologized to me. She said, I'm really stressed out. I'm sorry I took it out on you. I'm just really, time's a big deal to me. And I said, well, that's great. I'm glad you told me. Do you want a absolutely 100% guaranteed appointment? You'll never wait 1 minute in my office. And she said, can you do that? And I said, absolutely. I said, take the first one of the day, the first one after lunch. You won't wait 1 minute for me. You will be brought in every time. And today she had a 1:00 appointment. I numbed her as soon as she hit the chair.
Yep.
She was out two surface fillings. She was out in about 40 minutes. She thinks I'm a god now.
Yeah.
Because I kept my promise. I did everything I was going to do and everybody's happy. Meanwhile, does she know that I did 2 great DO fillings? No. One was an MO, one was a DO. She has no idea. And she doesn't care. She really does in her heart, but she doesn't know to care. But this is what we're faced with. So that's kind of where I wrote the book. And I wrote the book for the patients to say, hey guys, you want to be a great patient? think about what you're measuring your dentist by or your doctor by. And it's actually for doctors. When I wrote the book, I had a couple doctors call me up and go, why did you make this for dentists only? Because this so hits home with us too. Patients complain to us about the same things that they complain to you, and they don't care about the quality of the medicine. I take my staff's temperature and huddle once a month or so, and I go, who went to the dentist in the last couple of weeks? Tell me what was good and what was bad. And it's consistent. Oh, they were amazing. They brought me right in. I didn't even wait. I didn't hit my butt before. As soon as I hit the chair in the reception area, they brought me right in. Just question, how were they as a doctor? I don't know. He gave me a prescription and I was better 4 days later. Okay.
Yeah.
Well, maybe you were going to get better on your own. Maybe they're a great doctor, but that's not even how you measure them. So that's why I wrote the book. And for the patients to say, hey, guys, ask the right questions. I say to the patients all the time, when they're weighing their options and what to do, I said, you're asking me this question, like, does it hurt? How much does it cost? How quick can I get it done? Can I give you a better question to ask? And they're like, okay, what? So ask me, who knows, the expert, what would I do if it was me?
Yeah.
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 Forget everything you just asked me. All right. I know money's important. I know time's important. I know pain's important. But don't you think I know what's the best treatment? Ask me what's the most important treatment.
My business partner always says, and Rick, I think it lies a lot in your book, is that patients don't know the difference between a molar and a Maserati, but they know the way that they feel when they left your office. And I think we could add, they also know the way that they feel when they arrive at your office too. And it's so true, because that patient doesn't know that you did the best 2 class 2s. They don't know what they look like. They don't know what you're looking for, but they know if you were on time, they know if they felt pain, and they know if they got out on time, and they damn sure know what they paid. And so, they provide a value to that, an intrinsic value to that. And it's sometimes very hard to measure, but that's just so powerful, what patients want and what patients feel.
I'll tell you one thing, and I know it's a subject we're going to talk about. What I often do is, we try to educate our patients on, this is how big your cavity is, or how deep your cavity is, or how subgingival it is. We'll do those type of things. Since we have the benefit of a scanner now, and I'm a big Lumina guy, I will take my gorgeous crown prep that I am so proud of the margins, that my assistant has packed it beautifully, that you can see the margins from across the street. And I'll say to the patient, can I show you something? I go, this is a gorgeous crown prep.
Yeah.
And they'll look at me like I'm crazy. And I'm going to go, let me show you what I'm talking about. I say, these margins that you can see here that are clean all the way around, lab technicians love this. And this is why you're going to get a great crown when you come in. And I can guarantee you, when you come back in a week or two, it's going to be drop spot in. And I educate the patients on my dentistry. I try to, at least. Now, they may not care at the end of the day. They might be like, oh, he's so
Ew,
gross.
Ew, I don't want to see that.
Yeah. There's no blood on the scanner, thank God.
Yeah. I should have scanned the hole from the 16 today. Do you want to see what a great job I did removing this tooth?
No. We're talking a crown prep. We are talking.
But they do give you a wow factor on the scanner, though, too, don't they?
Yes. So I will tell you. I mean, I told you I'm a Align Global faculty member. I'm very proud of that, and I've been a faculty member for, I think it's 12 years now, and I've been using Invisalign scanners since they were Cadent scanners back in 2009, and we used to. I don't know if you guys even saw these, but it was a sewing machine
foot pedal
to use, and it's really funny. I had Dennis in today. I swear to God, coincidentally. And Dennis was my first bridge scan.
Are you serious?
Yes. And he reminds me from 2009, he'll go, oh, you got any better technology than you did the first time? And I'm like, dude, watch this. Okay?
Yeah, I'm not riding a bike anymore while I scan.
Riding a bike, I was using a walker back then, I mean, it was stepping on a pedal, and it took probably, I'm going to say conservatively 45 minutes. Okay. Yes. Okay. We didn't know what we were doing. We couldn't
Yeah.
get the angles. We were missing areas, and it was nowhere near what it is today. I mean, and today we scan him up, his entire scan, including, erasing his crown and going back, takes a minute and a half, maybe. Okay. And I know there's been a lot of, bad airtime about the Lumina and restorative dentistry. And I think it's a bunch
I
of
agree
baloney.
completely.
There's two interpretations I have in it. Number one, it's competitors making some noise, because I'd love to see the people who go, oh yeah, I've done thousands and thousands of crowns with Illumina, like all of us have,
Yep.
and loved it. I have 8 Luminas. Okay, I don't brag about the kind of car I drive. I brag about my 8 iTero Luminas. I think that's a status symbol to me. I think it's a sign of making it in life.
Yep.
And I have them. I have 4 offices, and I have 8 Luminas, and they're on wheels, and they fly around the office, and we use it for everything. And as far as its restorative capabilities, I can testify the accuracy. I can't tell you exact numbers, but if I told you, I would not be exaggerating if I told you 1 out of maybe a couple thousand, I'll get something back from the lab. This margin's not 100% clear. Okay. And I wish I had that same record when it came to when I was taking impressions for Crown and Bridge.
Yeah.
The patients, I can't even tell you, patients, we used to call them up. You have to come back in. We have to
Oh my gosh,
renumb
that
you,
was the
take your
worst.
temporary off. It's going to be another 2 weeks, and do that. I can see if the scan's good as soon as I take it.
Yep.
And there's a new tool that's coming out next week with the Lumina. You can actually draw your own margins.
Yep.
So if there's any question at all where your margins are, you can do it right there, chair side, right in front of the patient. You can draw your own margins. So there's no question whatsoever. So the technology on the Lumina is unequaled. And I think the competitors, and I don't know if there's stats out there, what's the most popular scanner, but I would argue, and I can only argue because I don't have the facts, the Lumina has to be right up there if it's not number one.
There's some good data coming out, actually, a couple articles recently on scanning marginal integrity with no prep and prepless veneers. It beat all the other scanners. And I wanted to jump in on that because as you were talking, I talk a lot about margin identification and how scanning a margin with a digital scanner is very different than what we do with PVS impression. And I think it finally just dawned on me that number one, the Lumina is so different because all the cameras are at the forefront of the wand as opposed to, refractory technology. And I think that the picture is so good and so clear that it is deceptive whether you really have a well-reflected margin or not. Because I often will scan, a prep that I do, and then I turn the cast stone on and I look at it like I'm trimming a die. And if I cannot see that defined line all the way around, I know I need to go back and rescan a section to make sure that my lab technician is not going to have any question as to where that location is going to be. And I think that the image capture is so clear and so crisp. And we have, as doctors, started to trust way too much pink and white. If it looks pink, it must be tissue. If it looks white, it must be tooth. And there's literally no in between. And you and I know, and Chad pretends that he knows.
Wow.
Nice. I like it. That was good.
That's the margin. And if you zoom in and look at the pixels, you actually can't tell. You can't see where the margin is. And so maybe that's what's going to come of all this, is that it leaps so far forward and it is so different. I made the argument the other day, it's almost impolite to call it a scanner because it's like calling a panoramic machine a CBCT taker. Like, it does something totally different using very different technology. And while, yes, the use cases are very similar to previous scanners, it's not the same anymore.
So, I've had a lot of privilege being a Align faculty member. And one of the things I got to do is I visited in Israel, the factory where they make the iTeros and the Luminas and the technology that goes into it. And without getting into a lot of politics, everybody knows there's a tremendous amount of innovation that comes out of the small state of Israel. And they've worked with technicians in the Soviet Union, or the former Soviet Union, in Russia,
Yeah.
and Israel and the United States, and they've come up with phenomenal technology. And when I first got the scanner as an Invisalign provider, it was to scan my patients for Invisalign. Then when I saw the technology, I was like, this is now my restorative scanner, period, hands down. And I'm doing the best dentistry of my entire career.
Same.
I have been doing dentistry since 1988. I know I don't look my age, Chad. I know what you're thinking.
You look fantastic, brother.
I know. Very well preserved. It's what the Sunshine State does for you. It keeps you current. I've never want a patient saying to me, I'm an old school dentist. I wheel that iTero in the room and I blow patients away virtually every time it comes into the room. If it's for Invisalign, for a consultation, if it's for restorative treatment. Today I had a patient come in. This is a true story. This is my last patient today. She came in on emergency. She had a blown out tooth number 14 that has to come out and tooth number 15 that's perio involved. And she kept saying to me, she said, can you do my whole exam today? Because I want to know what I'm getting into. And I'm like, I don't really have a lot of time, but okay, let me do your whole exam. And I did her whole exam. And my exam, you really don't even have to look in the mouth anymore. When you scan a patient, you look at the radiographs, you look at a scan. I look in the mouth because I don't want a patient to go, he didn't even look in my mouth, because that sounds weird.
Yeah.
And I was able to show her why she needed to have crowns on the opposite side, 4 crowns on the opposite side, because the restorations were so large in that tooth. And the iTero lays it out so clearly exactly where her decay is, how big her restorations are, what the need is. Then I can show her gum inflammation. I can show her plaque buildup in her mouth. I'm showing her all the things she needs to do. So I would go to battle with anybody who had any questions about the capabilities of iTero, because I think they're full of crap. I think they're out there representing another scanner company, and they're trying to promote it. But tell me you've scanned hundreds of crowns with the iTero and you're having any issue whatsoever, or your lab's having issue whatsoever because you're going to the wrong lab, or you have no skill as a dentist, or you're promoting another company, because this is the number one product in the number one piece of technology. And I bought a lot of technology over the years. Bringing the iTero and the Lumina into my office changed my practice. It's raised the quality of the dentistry with all the dentists in my practice. It makes it easier and faster. I mean, to scan a full mouth in a patient in a minute or two, because it's so fast, is unbelievable. And then be able to show your patients. They can't read x-rays, but they can see it right in front of their eyes on an iTero. They can see the crack in their tooth. They can see the NIRI technology that shows literally fracture lines running down their teeth when you switch to the NIRI technology. And anyone, please reach out to me if you have anything negative to say about the iTero, or you heard anything negative. I am more than happy to have a conversation with you, because the Lumina is hands down the most outstanding piece of equipment I have in my entire office.
Rick, what's a first scan? Is the Cadent the first scanner that you used in your office?
2009, the original. They originally changed the name of it, okay, but it was Cadent. That's what it started as. And then there were the elements.
For those of you that are watching, Cadent was the first restorative scanner. It since became the iTero, which has had several renditions, and it's been amazing since its inception. But I was using the 3M True Definition scanner, and I can speak by name because it no longer exists. And when I started using the 3M True Definition, it required powder, and it was labeled the most accurate scanner on the market. And when you looked at the studies, it was okay. They were able to claim that for a while, but their biggest pitch was it was black and white scanner, and they were like, "Hey, color adds no accuracy." Well, maybe they were onto something. Color did not add accuracy, but color added relevance. And it added relevance not only to your clinical acumen, but it also added relevance to the patient. And so, like JB said earlier, pink is tissue, white is tooth, whatever. There is so much power in the color. And furthermore, with the Lumina, the accuracy of the color is so lifelike. It is so powerful. And it really just adds so much. So although we may not be able to claim that it adds accuracy, the relevance to us and the patients is just second to none.
Yeah.
And when you hold an x-ray up like this, granted, hopefully we don't do this anymore, they get nothing. When you add digital to it, they get something. They still don't know what the hell they're looking at. But when you add that scan to it, it adds so much power to the patient exam. And so what you were saying, it resonates so loudly with me, and I know JB, but to our patients as well.
Yep.
Anybody who's going to question what we're saying, go check out the studies. Yeah. Right? Forget, I know this is going to shock you, but social media and chats, there's a lot of BS in them. I know that's going to shock some people. It's not all true. And, but go trust the studies. Go see the university studies. Go see, I don't want to name any of the researchers, okay? But all the top researchers, people that are measuring the scanners and things, those people are going to tell you the truth. What you read on a chat and somebody puts out there, and they will do everything they can to badmouth a product or a company. And let's face it, Invisalign has some people badmouthing it because they don't like when they raise prices. They don't like that they can't use a different scanner with Invisalign. It's very limited who you can do it with. But at the end of the day, get over it. Give your patients the best they can do. And if you don't walk around with grudges in life, you're going to be a lot happy. And if you're not walking around dental grudges, I've never had a dental grudge in my whole life. But there's a lot of people out there that have.
It's quality control.
Let it go. Let it go.
Yeah.
Use the best products you possibly can, because you're not going to move the needle with a company like Align if you think your personal, stampede against them is going to make a difference. It's only hurting you because you're missing the best aligner company in the world. You're missing what I consider the best scanner in the world. And you're going to see it for yourself. You're going to go back and go, oh my God. And as far as paying for it, I hope to God nobody's using, conventional impressions anymore, unless it's that one in thousands of impressions that you have to do it, because you're saving a fortune on impression material, thousands of dollars. You guys mentioned lab bills earlier.
Yeah.
Why do people know lab bills of Align and that's the only thing they know? Ask doctors how much they spent on adhesive in 2025.
No idea.
Not within thousands. Not within $1,000 they couldn't guess. All right. Or composite. They have no idea, but they see a lab bill because it pops up every single time with Align, or maybe their Crown and Bridge, when they get the bill when it comes back from their lab, they can see it. Guys, I take the voice of experience. All right. Don't get lost in what your lab bill is. Focus on quality for your patients, and you're going to save so much money over time in remakes and good faith with your patients, not having to come back for new scans and new impressions, and finishing your Invisalign cases in one set of aligners or one set of aligners and a quick touch up in a few aligners afterwards. And everybody's going to be happy. And you're not going to get lost in these silliness about, the lab bill's too high with them. I'm never going to go back to them again. You're hurting yourself.
I want to make sure we highlight, because I don't talk enough about it and we don't highlight it enough. The big bad company of Align actually has a GP board of advisors who go in and meet with them periodically to provide feedback. I mean, you made the comment, like, people feel like they just want to be the one man charge against Align, and I would advocate that they could actually be providing really valuable feedback to a company who, we've all had the privilege of working with Rick for quite some time, and myself more on the newer side, to say I've never gone to them with something that I didn't like or wasn't working the way I wanted, and they were like, screw you, you don't matter. They've always been like, oh, tell me a little bit more about that use case. And I'll say, well, I was doing this one thing and it did this weird thing, or I was trying to do something and I didn't like the way that the software performed when I did this thing. Or I didn't like that you changed and moved the button somewhere different. They've always been like, that's great. Tell me more about that. Let's get that in writing. Let's submit it to our developers so that we continue to make the product better. So if you happen to be listening to the podcast and you would like the Lumina to perform better for you, you would like to be able to be better in plastic, and you want to see this perform well because you have mentors or people like us who are saying it can be a real great workhorse and a real advocate for you in your practice, then let the three of us be that resource for you to take your feedback back to people who can actually make a difference and change the parameter settings or change the software to make it work better for you. That's the one thing that I don't think the message gets out enough. These are not headphone ears, not listening to the end user. I get questions and asked constantly by Align for feedback on updates and changes in software and new features. And do I like it? Do I not like it? Do I think general dentists will like it? Will it resonate? And that's because they genuinely care about the end user experience and they want to continue to make products that matter. And I don't think that gets enough airtime, frankly.
You know, when you go, we've all been to the Align Summit before. When you go to the Align Summit, everybody from Align's there and Invisalign's there. And you can go right up to Joe Hogan and have a conversation. He's very approachable.
Yeah,
he
is.
Super nice guy. And he goes and he speaks and he's around and he's there at the dinner and you can go up to him and you can talk to him. And like you said, the vision, the impression is that it's big bad Align, and it's not big bad Align. It's a company that listens and got to where they're at by listening, and they have feet on the ground. Your territory managers, people like that, and regional managers, and people that listen to you. And if you have something legit, you know, I told you I went to Israel when they were designing the latest. I think it was before they came out with the 5D element, and can I tell you, I spent a half an hour in a room with a gentleman who was working on the proper placement of the cradle, okay, where the scanner sat. And I was like, am I really? It's now, my wife is waiting for me. We're on vacation.
But he wanted to get it right.
And he wanted to get it right. And I was interested in letting him know exactly where he should put it. It should be put there. And they pay that close attention to detail. And they're always trying to improve. And like you said, it's the clean checks, it's updates, it's things like that. It's an ever-changing. Sometimes it's hard to keep up with the technology, but don't get scared by it. I mean, if I can handle it, you can handle it, and it's just a matter of embracing it and knowing you have great tools there for you, and everybody wins. You know, I say this in my book. I'm big on the triple win, and the triple win is the patients win, the team wins, my staff, and the office wins, which is me. And the triple win is if everybody can win, it's a great thing. And the triple win when it comes to Invisalign and iTero is everybody wins. You know, it's not me winning alone. It's not my team being able to scan and have those tools easier. It's not just the patient. Everybody wins.
That's great stuff. I mean, I couldn't agree more with everything that you've said tonight. We went over, but that's okay because we were having a very spirited conversation.
I knew we would.
I knew we would too.
I knew we would.
I mean, and hold your book up as I close this out tonight, please, if you don't mind.
It's backwards, so it's not going to work too much. But it's called The Big Smile. Okay, you can go on Amazon and order it. We're actually #1 in about 4 categories at one time. So, I mean, I don't really push it. It's something I give to my patients. I give to colleagues. You know, I mean, look, you guys are spreading the gospel here and you're helping doctors out. And when you learn, again, when you give stuff away, it comes back to you exponentially. And I've learned that too. I have so many great colleagues at Align that I can pick up the phone and say, hey, can you share your deck with me on this? Because I got to give a lecture, or you went to this area and you did this. And guys, you're only in competition with yourself.
Yeah.
I mean, I talk about that in the book too. You're not in competition with the guy across the street. I have a dentist across the street from me. I swear to God, I don't even know his name. And his office is 250 feet away from my office. And I don't know his name. And I don't care because I control my own destiny. And if you do a good job, you do things right, you'll be successful. and just do the right thing. And the right thing is using the best you can do. Don't give your patients the cheapest or whatever you get a deal on. Give them the best, and you'll be the best, and people know you as the best. Guys, you swell my head when I come on here and go, "Oh my God, Rick Mars, I've known you." Thank God I have a good reputation, but you work on your reputation your whole career,
right.
your whole life. And it means a lot to me. It doesn't swell my head. It means a lot to me that to have the respect of my colleagues, that I'm a good guy and I speak the truth, and I'm a nice guy. That to me is I've accomplished my objective.
I think that's a wonderful note to close on there. And that's the way that I know JB runs her practice and the way that I run my practice. And at the end of the day, I mean, not to go too faithful on everybody, but, I want to be labeled a good and faithful servant, not just to the world, but to my patients. And I think that's what we're all striving for, is just be a good and faithful servant and be a good person in the community, and to do the right thing, and to use Kleenex and Align in our practices as well, because
without the lotion.
Yeah, no, with the lotion. You don't want the little fuzzy things on your beard.
Two out of three of us have a clear situation here that we don't worry about.
That's
the
right.
lotion.
I've never thought about that.
That's right. Well, hey,
I didn't know they sold it with lotion, to be honest.
Anyhow, Rick, thank you so much. Everybody go out and buy The Big Smile. If you want to learn from somebody, learn from Rick. He has a fantastic book, and he has built a fantastic empire in Southern Florida. And Rick, we need to get together soon, dude, because I miss you, and I had a great time the last time I saw you. So thank you so much for being on the show, and appreciate you.
I will come back anytime you guys ask.
Yes.
This is way, way better than Smartless and Joe Rogan, I have to tell you.
Hey.
Way better.
Well,
so
I love it. I appreciate it. Thank you so much.
I know you're lying now.
I thought JB meant Jason Bateman. I didn't know it meant Jennifer Bell. So this is really...
It would have been cooler with Jason. He's actually a really funny person.
No. Sorry. You win, Bell. You win every time. So, okay, this was great. Anytime, guys.
We appreciate you so much.
It's my pleasure to come back.
All right, everybody, have a great night.
Everybody.
Take care.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.